So it's generational, it's historical, and it's ongoing today.
Dr. Dawn Owens-Robinson works as an OBGYN at Advent Health of Vista in Louisville. She's been doing this work a long time.
Over 23 and a half years.
In that time, she's seen firsthand the disparities facing Black women in healthcare.
So if we're talking maternal and pregnant women, we are 3 to 4 more times likely to die in childbirth or the first 42 days after delivery. Black babies are 2.5 times more likely to die in the first year of life.
These disparities aren't just frustrating, they can be deadly.
It's because of lack of income, lack of jobs, lack of employment, lack of insurance, racism, institutional, systemic. In the healthcare system, it's lack of generational wealth, it's lack of food, it's food deserts, maternal deserts. The list goes on. People want to say it's access and people want to say it's poor. But Dr. Shalon Irving worked for the CDC epidemiology department. She had 2 PhDs, 2 master's degrees, and was fighting this same subject. And 15 days after delivery died.
She says having a provider who looks like you and understands you can make a difference.
Studies have shown that we survive better, our Black babies survive better, we listen better, we do better when the providers in front of us have similar cultural backgrounds and respect from what we're coming from.
She's seen it firsthand.
When you can walk in the room, even with mask on, you could see their face light up. You could see their shoulders drop down. You could see them smiling beneath the mask because they're like, ooh, this doctor looks like me. So I think it's just a level of comfort and trust.
And it's not something that's common. The National Medical Association reports less than 6% of physicians in the U.S. are Black.
And I think that's where it starts. I think we need to look at ourselves and see where we can do better.
Dr. Owens-Robinson says graduating med school, now serving women, means so much.
I think it's even more meaningful 23 years later. I tell patients, sometimes I cry at deliveries, and I tell fathers, I said, this is a miracle. You know, I'm involved in the miracle of life every day. So I'm blessed.
It's hard to imagine yourself.
That's what drives Dr. Owens-Robinson to advocate for equality in healthcare. She says implicit bias training in healthcare should be mandatory. More education, especially when it comes to prevention, is key. Now, for the delivery room, she says having midwives and doulas can make a massive difference in creating positive outcomes for both mom and baby. And the big one, she says we have to address and deal with generational systemic racism in healthcare and begin the long path forward to addressing and improving it.
Yeah, she's remarkable, and we need so many more of her. It just should be a perfect, beautiful time, not scary or uncomfortable.
Yeah, absolutely. She said she'd love to see a lot more providers who look like her.
Absolutely. Thanks, Rachel.